Hello everyone, and welcome to your ultrasound portion of the third year internal medicine clerkship. We'll just go over the goals and expectations of you while you're on this rotation. A brief word about scanning. Before you start scanning, make sure you read over the scanning tips in which provided to you in a separate Word document. Also make sure you watch the V-scan tutorial that goes over the different buttons and how to drive the machine, get comfortable driving the machine. And then finally, make sure you're practicing even before the gel round sessions. Make sure that you're getting comfortable just driving the machine, adjusting things like finding the proper preset, changing your window, adjusting things like depth and gain. Make sure you're kind of putting time limits on yourself as you're scanning. The only way you're going to get better is if you sort of put a little bit of time pressure on yourself to get that scan done in less than 5 minutes. Ask your colleagues for feedback and give your peers feedback as well as talking to the residents and faculty about your images. So brief word about recording. For the vast majority of the time, you should be recording loops. There are some times where you're going to record a still, in which case you can just hit the black center button, which will freeze the image, and then you can hit the little floppy disk icon, which will save it. But for the most part, you're going to want to record a loop, and so make sure you're hitting the freeze button and then hit the right triangle, which will play the loop, and then you can sort of see the recording that you're actually saving. And a lot of you guys tend to just hit the save button as you're scanning, which will in fact save a loop, but you don't get to see what it records. So make sure you do that. A word about student gel rounds. They're going to be generally on Tuesdays from 1 to 2, sometimes maybe up to 2:30 if they're really good, interesting cases. We'll meet in the basement classroom afternoon conference. Please bring your V-scan charged, ready to go, as well as some gel and your stethoscope, of course. And then make sure you try to find about 2 or 3 patients on your team or on somebody else's team, or even if they're not on the team, somewhere in the hospital for you to scan. High yield topics tend to be people who have heart failure or cirrhosis or end-stage renal disease. Give us a lot of opportunity for teaching. But anything really that you're interested in, just sort of come a little bit prepared for those sessions. That really increases the yield of the sessions. One of the things that we haven't done in a while and is still open, but you guys, if you want to do it, you just got to email me to request it, is do like an image QA or feedback session. We have done these in the past at the Ultrasound Institute, usually on a Monday, and that gives you an opportunity to get feedback on your images prior to the rotation being over, and you get practice sort of critiquing other student images. We vote on the best images, and also gives you a chance to practice with the new simulator, which you will be seeing sometime during or before your OSCE. So make sure that if you're interested in that, just give me an email and we can set something up. As far as recording your scans, you have 2 options. You have the log form, which allows you to just fill out the minimum requirements, which are just the scans listed on the log form. However, if you want to go beyond the minimum requirement, I encourage you to use the electronic form. If you only want to do the minimum, just fill this sheet out, keep the paper copy sort of in your pocket, and just fill it out as you go along, and then just turn this in on the day of the OSCE. For those of interested in sort of doing it electronically, there's a log form. It's a Google Doc that you can create a shortcut to your smartphone, and then you have that readily accessible to you, and that allows you to put a bunch of scans together all in one form, and allows you to track things for longer. You can log several scans simultaneously if you do them on the same patient in that way. For those who want to go sort of above and beyond, they can access a different log form, which we will then use sort of to compile an image portfolio for you towards the end of your medical school curriculum. And then if that's something that you're interested in, just work with me and the folks at the interest group, and we can get you set up to do that. So a brief word about educational resources. I've compiled a bunch for you guys here. For the beginner, make sure you guys are checking out the Society of Ultrasound and Medical Education, taking a look at some of those learning modules. They go over the basics, and they should be pretty familiar to you based on the labs that you've done. We also have a YouTube channel at the Ultrasound Institute. It goes over several different videos. If you're wondering to yourself, how do you do a plaques view and need a refresher on that, feel free to watch the videos. This is also where you'll find ultrasound videos of the lung, which is something that you might not have been exposed to the first and second year. So do make sure that you're familiar with ultrasound of the lung. For advanced students and sometimes residents and faculty, I recommend the following websites, and I'll just put them in here for your reference. This is by a guy named Thomas Binder, who has a phenomenal setup and is absolute master of teaching echocardiography. This is what I like to consider the Walmart of ultrasound image gallery, as well as teaching references, as well as all sorts of different web links and things like that. So it's really one-stop shopping for a lot of the online ultrasound needs. There are lots of Vimeo websites and image archives that are available through multiple emergency medicine websites. And then we have multiple 3D modeling and orientation videos available. Sonasite has a number. We've made a couple of them. And these can be really helpful as far as orienting yourself to the anatomy if that's something that you're struggling with. A couple of websites that are really good include Ultrasound of the Week, and here are some textbooks that are really good. I think this one here, the Point of Care Ultrasound by Sony and Artenfeld and Corey here, is really top notch. This one by Noble and Nelson is also really good and is a quick read. Of course, we have our own one that Dr. Hopman is the editor of, and so I have to obviously plug that for you guys. This is what I would consider to be one of the best resources, is this Introduction to Bedside Ultrasound. It's an iBook. You can often download it for free off of the iTunes store. If you're interested in OB, this one is also available for free. I also recommend these online resources, especially if you like podcasts. Ultrasound Podcast is really well done and also highly entertaining. They also created a 1-minute ultrasound app, which is something I recommend you put on your phone. It's very useful. Lots of online resources. To include Twitter. If you really want to get into ultrasound education, Twitter can be a fantastic resource, believe it or not. Strongly recommend following different ultrasound educators and following these hashtags up here. And then get involved with the Ultrasound Interest Group. I strongly encourage you guys to make the most of that. You guys have a tremendous amount of resources available to you here at this institution that other schools don't really have, so please take advantage of those resources and build on them. And make sure you, when you're building them, you're sharing your favorite and most helpful resources. We want to make this better, so really help out your peers for the future. So with that in mind, we'll just jump into a couple of quick views that you're expected to get as far as references. Make sure you're watching the videos that are available to you online. And taking advantage of the resources that Kiasha will be sending out to you. So you have here a normal plaques view on the left-hand side. You have a pericardial effusion here on the right-hand side, and here's an example of severe LV dysfunction where the mitral valve doesn't even approximate the interventricular septum here. So, and here's your classic sort of normal subxiphoid view with absolutely no pericardial effusion and normal LV function. Here you have a significant pericardial effusion with some right ventricular collapse here. This person actually has tamponade. Here's a normal IVC over here. You get a little bit of a normal IVC that collapses with respiration. Here's the very enlarged IVC here that's plethoric and dilated. This IVC is what we call the sliver in the liver. And you can see that serial IVCs can be very, very helpful in monitoring somebody's treatment. So this person has heart failure. This is initially when they're coming in, and this is after a few days of effective treatment. Get really, really good at the right upper quadrant home screen. That's, you got your liver, kidney, vertebral bodies, diaphragm. And this is how we diagnose a lot of different conditions, get really comfortable with those views. The left upper quadrant view is similar, but usually trickier for folks to get. Get comfortable with the spine sign. We're going to see a ton of effusions on this rotation. And then this is our jellyfish sign with the lung sort of floating around in a bunch of fluid. So just keep the image orientation so that cephalad is going to be on the left-hand side of the screen and caudal is going to be on the right-hand side of the screen. Here, this is somebody who's pointing the probe marker up towards the head but has left it in the cardiac setting. And so the orientation then is flipped. So please make sure that you have your orientation sort of standardized, and so cephalad should be on the left-hand side of the screen. So in terms of just some basics, this is a basic lung ultrasound. You can watch the lung ultrasound tutorials, but you're looking for, under normal circumstances, curtaining here in the near field. This is air-rated lung blocking the far field here, with a normal sort of mirror image artifact where this looks like liver on both sides of the diaphragm. Versus here you have a positive spine sign where you can see the abdominal spine that continues on up into the thoracic cavity, which normally you can't see when there's no pleural effusion. This is an example of, again, a normal right upper quadrant sort of home screen. This is somebody who has a large amount of ascites. You can see their bowels sort of floating around in all that fluid, kind of looking like a snake about to pop out of a can. And here the fluid is measured in its deepest pocket, which is something that you're asked to do when you find somebody who has ascites. This is a real nice example that one of the students obtained. This is a liver, and there's clearly free fluid in Morrison's pouch in between liver and the kidney here. And you can see the fluid wraps all the way around the liver. But what also can be seen is a little bit of fluid just above the diaphragm. And then here, in this person capturing this image of this pleural effusion here, if you look carefully, you can actually see the diaphragm. And on the other side of the diaphragm, you can see a little bit of fluid right there. So this is fluid above and below the diaphragm. These are examples of the gallbladder and its long axis, and here's an example of the gallbladder in its short axis here. Here's some examples of gallstones. You can see the gallstones with acoustic shadows sort of behind them. Here's some gallstones in the short axis with acoustic shadowing behind them. Just one brief bit of advice about scanning gallbladders. Just please remember that in order to find a gallbladder, a lot of times the gallbladder has to be distended and full. So a lot of times you're going to want to find people who have been fasting or MPO for a long period of time, and then scan their gallbladders or look for their gallbladders. A lot of times students tend to go gallbladder hunting right after lunch in the afternoon, and the gallbladders are notoriously difficult to find in that setting. So just keep that in mind when you're hunting for the gallbladder. Here's a normal abdominal aorta in the long axis view here. This is a large IVC next to a normal sized aorta in the short axis view. Here we have some color flow Doppler. of an aorta, which is by definition aneurysmal, with it being greater than 3 centimeters here. So, and then this is how you measure urinary bladder volume. Again, we have all sorts of videos on this, and hopefully this is a review for you, but just in case, here is just a rapid resource for you.